what we're doing around ABPN policy, the activity that we've got going there. And then looking at you as an influencer and what you can do in terms of moving certainly policy into practice, but also influencing practice and influencing policy. I think often as a nurse, you tend to think that you've got a lot of opportunities to influence practice, but not so much policy. I'll try to challenge that idea. And then look at some of the challenges that I think we've probably got in terms of making healthcare policy work for children. Next slide, please. So what do we mean by health policy? And the next slide. In terms of the definitions, there are a lot of definitions if we're looking at health policy. And I could have looked at health policy, government policy, all sorts of different policy. I think today it's really focusing on the health aspects of that. My favourite is the World Health Organization definition that's there, because it talks about policy being about decisions, plans, and actions that we undertake to achieve specific healthcare goals within a society. And to me, that sort of brings it all together. Other definitions perhaps don't recognise that full range of the decisions, plans, and actions, and focus more on the plans. In terms of public policy, the reason for putting this government white paper of 1999 up and their definition is because those that you were around in 1999 will remember we had a Labour government then. So that's why I've pulled it up, because I think it's still very relevant. And as we move forward with this new government, it's going to be that potential for us to look at how government is going to translate a political vision into the programmes and actions to deliver healthcare outcomes and the desired changes in the real world. And I think we've seen Wes Streeting, the Secretary of State for Health and Social Care, talking about these desired changes, talking about fixing the NHS. So I think that's giving us a real focus on the policy for the next period of government activity. Move on to the next slide, please. So how do we get from a political vision to the reality? So how do we turn that issue that they see as a political party into their policy? Well, they'll take that issue and build it into their manifesto promises. So if we think back pre-election, and it's not too far for us to look back, but there was a lot about changing policy, about making things work for people. And to get there, we need a green paper which sets out those ideas, and there's very often a consultation. I find it quite interesting that this time we're getting the consultation before we're getting a green paper, a plan. But we'll get a green paper where there's more opportunity to influence. And very often the white paper, which sets out the actual plans, and moving through legislation if we need that change in legislation. So if we think back to the previous Labour government, there's quite a lot of legislation changes around the way money could be used and spent. So they're not, I would say, a government that is going to sort of shy away from legislation. They try to avoid it because legislation takes up a lot of debate time in the House of Commons and the House of Lords. And I think they really have set an agenda that would indicate that they want to make quite a lot of changes. So in terms of getting that vision to reality, issue into policy, we can see that we've now gone past that manifesto stage and we're looking at policy. We're not going to be looking at a new manifesto for several years yet. So let's just work with the policy as it's coming through. Next slide, please. I was delighted last week. I'd got all sorts of different slides, and then this was published. So the health policy context in England is really clear for us at the moment. The Change NHS consultation is out there. The government are telling us that they want to have those conversations to help build a health service that's fit for the future. So we've got that policy context, and I think we can see that they are saying it needs to be fit for the future. I'll move through a number of the other issues around that consultation document as we move through the presentation, but really that's setting the context. Until last week, I was working a little bit in the dark, thinking, well, what have they said? How are they going to do it? But in terms of health policy, we've now got this document. Over the weekend, we had a promise that there was going to be a similar consultation around activity in social care. We've got an indication that there's going to be a new education bill. So from a children's perspective, we can expect a fair amount of change. Again, there's always a lot of change, but we've got a government that's giving us that indication that that's where they're going. On to the next slide, please. And the next one. That really is just sort of setting the fact that we are talking about children. And I am going to sort of just specifically look at children. And really, a lot of it is around the health policy, because I think that's where we're at the moment. We have a lot of work around health inequalities that's already happening, and an indication that the inequality agenda is one that this government wants to tackle. Therefore, I think health inequalities, the policy is going to be there. Public health and prevention, moving away from that sort of cure, the fixing it, let's try to prevent it. Mental health and wellbeing focus around all age groups, but a lot of work around children happening in other organisations. So this isn't a government that's just working in a silo. It's going to be picking up those indicators from different areas, such as the Royal College of Paediatrics and Child Health work that came out during the summer, that we're going to be seeing that, yes, there's a recognition that we need to be tackling issues around mental health and well-being, and really recognising that alongside the public health agenda. We know that we're still struggling in terms of workforce, so the workforce agenda isn't going to go away. With the last government, we had the promise of a long-term workforce plan so that we could look to the future and what we needed. And I doubt very much that this government is going to say anything different other than we need to look at that workforce. And we've had a very clear indication within the conversations around the consultation document that we're going to be moving away from hospital to community. I think that's going to be quite difficult because we're still going to need hospital. But what would it mean for children if we did move away from hospital into community? I think that gives us a real opportunity yet again to say we need proper community services to be able to do that, so that we continue to work with that. Next slide, please. And if we think about what influences policy, people do. That's the main thing. People, individuals, organisations, and realistically, we've had a government that hasn't been in power for long, but we're starting to sort of see behind the scenes the influence of individuals, some very strong individuals there. So people are really key to this, and we can do that as individuals, or through organisations. People make organisations. Organisations don't just sit there and create themselves. It's people that create them. So people have got the biggest influence on policy. But so do the global issues, the national issues and the local issues that we're facing, because we don't work in a silo. We don't work just as the UK. We don't work just as England or Scotland or Ireland, Northern Ireland, or Wales. We work as a UK nation, and we also work as part of that global response. And I think seeing the various leaders together recently, we recognise that, yes, we do have a role to play in the wider world agenda, in the Commonwealth agenda. Still linking into some of those European issues. We're not working just as the UK alone. We also have all party parliamentary groups. So as that suggests, it's all parliamentarians can join the groups, and it's not just the Labour Party or the Conservative Party or any other party. It is that MPs from all the party groups, all the parties can join that group and focus on different areas. So we will have groups that will be looking at things like palliative care, children's palliative care. That's one of my sort of ones that I follow quite closely. And what we're seeing now is a new government in, lots of new MPs, lots of MPs who didn't come back after the election. So these APPGs are really starting to look at their membership and starting to develop the work that they take forward. Well, party parliamentary groups are incredibly powerful, because if you've got all parties agreeing that certain issues are important and need looking at, then you've got all parties able to influence the policymakers. The policymakers being the ministers and the civil servants behind them who are developing that policy. So incredibly powerful, and quite often the groups will be seeking advice and input from individuals. So really useful to find out if your local MP is a member of any parliamentary group that could be useful to the child health policy areas. So worth having a look, sort of going on to the gov.uk website, the government website, and actually looking at, well, finding your local MP to start with and just seeing what membership of which groups they've got. We also know that professional documents are very powerful, and I've deliberately pulled out here the RCPCH because they have been very active recently in getting out that sort of their regular state of the nation type documents. So they are pulling out that evidence and they are presenting it as their own document, but very useful for us to be able to use in terms of the evidence that they have pulled together. So it's a bit of a shorthand, really, that we can use those documents, but they are very, very powerful in terms of civil service, sort of being the people who are writing those policy documents. They're a godsend, to be quite honest, because they really do provide you with a lot of information and a lot of up-to-date, as it is now, type of information. And as well as the documents that they produce, it's also worth recognising that those royal colleges and professional organisations can sit around tables and have direct input. So worth using your membership to ensure that you know what's being said and trying to influence your own professional groups. We have things like, and I've pulled out NICE quality standards. There are different standards, but NICE, as one of the arm's length bodies for the government, have traditionally been very useful in terms of being able to influence the policy. So before we get the quality standards, you know that there's a lot of work. There's a lot of work in pulling together the evidence that's needed around standards, but there's also a lot of work in the conversations that happen with some of those professional organisations and some of the leading professionals as well. So yet another thing that can influence policy. And the media. The media are often seen to reflect public opinion. I don't know about you, but conversations I've had recently around media, it seems that nobody believes what the media are saying and are questioning why the media are saying it. So whether that is such a strong influence, but certainly when I worked as a civil servant, it was one of the first things in the morning. You would get your media pack and you would see what the stories were for the day. And very often we would be trawling policy ideas, usually on a Sunday newspapers, and seeing what response there would be from the media. And things may change before they were due to be published on the Wednesday. So yeah, the media certainly does have that incredible influence. And I think behind all of this, because I think, you know, if we look at people, if we look at the parliamentary groups, if we look at professional documents or the standards, what is behind the policy is very often the evidence base. Whether that's you know, a recent report, whether it's building on trends, really very useful to know what the data and the evidence is behind the policy. So if we move on to the next slide, please. And the next slide. Recently, the ABPN has established a series of working groups. So this is how we're currently developing our work around policy. So for those of you that don't know the ABPN, we have a leadership group for the organisation, which is the Governance and Development Group. So that does what it says on the tin. It ensures the governance of the organisation, that we're working to our stated aims and our constitution, but also looks at development in terms of developing the opportunities for us to influence agendas, developing opportunities for members to become involved, and also looking at what we can do for members. So a busy group. We don't have any professional officers, so that's something that's quite different to a lot of professional organisations. We're still the oldest children's nursing organisation in the world, so this ability to continue and influence and be led by people who are linked to the real world, I think gives us an incredible strength. So we have people who are working or who have worked in positions within clinical research, education roles. So that's the Governance and Development Group. But because we've got people there who are working full time, then the actual work was taking up a lot of time. So this year we've established 3 working groups. The Policy Development Working Group, which is the one that focuses on policy. But also we have a membership and an awareness raising working group. So this year focusing on how we link with our students, as well as the communications working group, which is looking at the communications we're coming out. So the top and the bottom group there, the policy development and the communications working group, working closely together, so that the policy development working group develops the policy, develops the position statements, and develops background papers to inform members. And the communications working group looking at the messages that we're putting out, so developing the various press releases, of which there have been many over recent months. So busy working groups, but hopefully will give us that visibility with nurses, with children's nurses across the UK and wider, but gives us that opportunity, certainly in policy development terms, to be able to focus on the work. Can move on to the next slide, please. So since the summer, we have been developing policy statements in terms of the different areas there. So our first one was around assisted dying. Now that came in because Lord Faulkner talked about his new assisted dying bill, which has been presented into the House of Lords. And we felt that we should have that background paper, which talked about what assisted dying is, but also a position statement that acknowledged that the ABPN did have a position to take, because although the bill talks about adult assisted dying, recognizing that the young people that we're working with are becoming adults. So talking about this sort of marking the ground of over 18s, it is neither here nor there. We're working with those young people who may be considering these different issues. However, we also recognise that it's an emotive issue. It can be a contentious issue. And as a membership organisation, we recognise that our members will have a whole range of different views and opinions. So we would like to influence the discussions and help people understand the needs of young people and young adults up to the age of 25, but we're not saying whether they should or should not be assisted dying, because we recognise that as a membership organisation, unless we had an in-depth consultation, it would be really difficult to do that. So that's that first paper. It's also the latest paper, because we have updated it, because obviously there's now a bill in the House of Commons. So there's a little bit more in terms of the background paper. The position remains the same, although there are bills in two houses now of the House, at Westminster. We've also got a background paper and position statement on children and young people's rights and on poverty. And the reason that we have those two different position statements is that as an organisation, if we're looking to build responses to consultations of different types, there are some building blocks we felt that were going to be needed. And it's really about saying quite openly what we believe about children and young people's rights and what we believe about sort of changing childhood poverty. So they're two of the building block statements. Lord Darcy's review, again, a background paper. Now, the background papers really aim to support nurses and to just have a couple of pages to read rather than the 100 and however many pages in the different review. So it really pulls out some of those key issues and then sort of say what we as an organisation would want in that position statement, what we would want to see following the review. And then finally, we've got the NHS consultation, and it's sort of a heads up here that it would be useful to know what you would like us to be saying in response to the consultation. So I'll come to that right at the end of the presentation. But we've put a background paper together, which really just talks about, the questions that the consultation is posing and ways that you can respond to that as individuals or as staff team groups, as local branches of different sort of networks, that type of thing. So it really at the moment just stands as a background paper. Next slide, please. Just in case you haven't seen it, it's there. The change the NHS change, helping to build our services. And as I say, I was certainly relieved that this came out before this presentation, and actually gave me time to read it before the presentation today, because it really is going to be the focus of I would say of a lot of our work, whether that is in developing responses to the consultation, sitting around tables, advocating for children and young people, sharing good practice. It really does give us that opportunity as children's nurses to influence policy before it is developed. Next slide, please. I'm going back to those definitions because I think I said right at the beginning, I like the World Health Organization talking about decisions, plans, actions, a desire to actually achieve goals around health. And at the same time, pulling out those sort of programs and actions and outcomes and desired changes, because I think that what we'll see following the consultation is probably a mixture of the two. But I would be very surprised if we didn't see that focus that was there sort of 25 years ago now, in terms, yes, it might be a quarter of a century, but we did have a government that recognised that, we don't just have changes for change's sake. We need to have achievements that can be measured, and we need to have some of those outcomes. So just remembering that as we work forward around how we can influence policies. Next slide, please. So I don't know whether you've looked at the website yet, but organisational responses need to be no more than 5,000 words. And within this, I've just pulled some of the issues out that I would see that we probably do want to say something about. And I think it is, to start with, thinking about the workforce, but thinking about nurse education. I think we can't have a consultation on the future of the NHS without talking about the future of our profession. And right at the sort of forefront of the future of our profession are our nurses who are being educated at the moment. So I've pulled out education as one of those key themes. But workforce, then we've got to be talking about numbers. We need to be talking about recruitment. We need retention. And we've got opportunities around returners. So yet another sort of area where we can be responding. What do we want to say about hospital services for children and young people? I think there's a lot that we can say. That's a personal view, but we know that hospital services are good in some places, are fabulous in other places, but could do better in some places. So how are we going to get us all to the fabulous situation? So what do we want to say about hospital services? There's that focus on moving from hospital to community, but what does that mean for children? And what do we mean by community? Do we mean just their home? I don't think we do, because we're talking about hospital to community. So where do we find children? We need to flag up where we find these children. We find children in homes, we find children in schools, we find children in different groups, we find children in children's hospices. We find them all over the place. They are there, they are through society. But if we're going to start to deliver more services for children within the community, what do we need? I think in terms of looking at workforce, we've traditionally looked at a workforce plan for the NHS, and we know full well that the NHS loses staff to a whole variety of different areas, whether that's to the independent sector, whether it's to the third sector. We lose those nurses. So in terms of workforce, and particularly if we're starting to look at expanding services in the community, what does it mean for our workforce numbers? What about prevention? There's this sort of tendency to sort of just talk globally about, what do we mean by it? Well, do we mean physical health? We probably do. Do we mean mental health and well-being? I think we probably do. But what do we mean around prevention? Another hat that I wear is as a magistrate, and a lot of the cases that you see coming through the criminal justice system, it really is, you sort of look back and think, if only somebody could have picked up the young people when they started to exhibit different issues within schools. Very often, the school health side of things has been decimated. So what do we want to say around prevention for children and young people? And can we do this alone? I don't think we can, because children are neither just sort of hospital based or community based. They're both. They are working, they are living and sort of thriving in family homes. and we don't provide services on our own. So what are the partnerships we should be building? Can we just let this consultation go by without mentioning schools? Personal view, I don't think we can. Can we just sort of overlook that important sort of early childhood childcare situation where we know that people are struggling? I personally don't think we can, but we've only got 5,000 words. So what do we say? And, you know, really, what do we need and what do we say? Go to the next slide, please. If we take 5,000 and divide it by 6, and I think we could probably divide it by a lot more than 6, we've got about 850 words that we can use per point. So refer to existing documents. That's how we can actually make the most of the words. Existing documents can be added as an extra. So for me, the ability to develop our various sort of background papers and position statements helps us just refer back to some of those possibly. And, you know, what's the key point we want to make? What are the key points? And then build from there. And this is where I sort of feel quite uncomfortable, because I sort of think, yeah, it's a consultation, it's not an academic paper. And I think that is a real need for us to know what data and academic papers are out there and reference them. We can shorthand the referencing, and I'm looking, I can see Bernie on my slide, on my screen here, but I think it is about, let's know what the work is, and you know, let's include the findings. We don't have to start from scratch and write it as if we don't know that there's the evidence out there. We can use repetition to emphasize a point. So, for example, if we want to say something about building community services, I'd suggest that we'd put it in the community box, but we'd also be putting it in the hospital box. So we could repeat the point we wanted to make about, I don't know, I'm just going to suggest it's about more CCN services. I don't know whether that's what we want or not, but if we do, we could say that hospital services could be improved. We could get earlier discharge if we had more services in the community. We put it in the community box, but don't use it thoughtlessly. Get people to proofread what you've said, because they're the ones that are going to pick up the fact that, you know, you've possibly cut and paste and put it in 2 different places and it's the same thing. It can be changed. Use repetition to emphasize, but don't just waste words. Clarify keywords at the beginning. The one that we tend to do in all of our documents at the moment is the term child, because we know some people would talk about children, babies, infants, neonates, toddlers, children, young people, young adults. So what we say is, the term that we use for child covers all of those up to the age of 25, right at the beginning. So instead of having to put that whole sentence in and use 10 words, we use 1. I'd also suggest that you can use abbreviations. So for us, if we were going to be talking about the ABPN's position, having spelt it out in the, I just realised I've missed one of the words out there. It's Association of British Paediatric Nurses, so it would be 1 word instead of 5, not 4 as I've written there. But we can do that. It's about just making the most of those words. So yeah, it's always difficult to write by committee, but use your committee to look at how you can change phrases, you can shorten phrases, so that you can actually say more using the same number of words. We move on, please. The next section, I'd like to look at you as an influencer. So I can't see all 13 attendees on the screen, but I'm guessing we're all children's nurses. I guess that's why we're all here. So that's who we are, but what influence do we have? Go on to the next slide. I'd see that every nurse potentially is this. You are a person, you're a member of the public, you're a professional, you've got that professional knowledge, understanding, skills and experience. You may be a politician, and recognising that nurses are politicians. We have some in Westminster, we have a lot more that are around in local politics. So you could be all of those things if you want to be. And you can influence in each of those different roles. So as a person, you have the opportunity to influence your local councillors, you have the opportunity to influence your MPs, you have the opportunity to work within local groups, if you so wish. In terms of professionals, then you have your work role. You know, who knows what their team's going to be doing in terms of the consultation. Are you sending in what's good where you are, so that when we're talking about what changes could happen, they'll know what you've done? Don't assume that they're going to go back to various awards ceremonies to see who's done what and what's good. It's always useful, though, if you're a civil servant, that you do that, because you can see what other professionals regard in a positive way. But share your information. If it's been published somewhere, put the link in. You don't know the whole story yet again. But you can do that within your work team. You can do that within your professional organisation. So try to influence your professional organisation. If you see something that's out there in policy terms and you want them to say something about it, then get in touch. That's what the professional organisations are there for. It's to reflect membership views, and it's really there to promote that best practice that we know of. And if you want to become a politician, well, I'm not going to say very much about that. You probably know more about how you can become a politician in your own right. But certainly there's local and there's national politics, and nurses have that right to be around that table. You move on, please. What I would ask is, what matters to you? So what really matters in your day-to-day work? What really matters? Is it that you haven't got enough staff? Is it that you don't feel that there's sufficient support in terms of education, training, opportunities? What matters to you? Is it more precise than that? You know, is it something that is very much about clinical policy? How does that clinical policy and clinical need that matters to you turn into local, national, global policy? We know that the UK has an incredible influence in the world of children's nursing. So who else cares about this? You're not going to be the only one that cares. It's always worth talking to others. So think about your own agenda, think about your own sort of wishes in terms of change that you'd like to see. Next slide, please. Find the policy. Now, I've used this slide for so long because it's like, how many books can you see about cats? They all have something to do with cats. So if you put child health out there, you'll come up with, shelves upon shelves upon shelves. So how do you find the policy that's relevant to what you want to do? Is there a policy out there? Is someone doing something about it? Move on to the next slide, please. Decide what's relevant. So go from the shelves, the bookshelves, and that's where searches, online searches are fabulous. Find out what's relevant, find out what's new and relevant, find out what's perhaps old and relevant. But you can do that in all the usual ways. You can do that in terms of keyword searches. We've all done that, so you don't have to read absolutely everything. You can narrow that down. Has anyone seen the ABPN newsletter recently? because it's fabulous. It saves so much reading because it's all there. So it's just so helpful, I would suggest, to children's nurses. It's been out there, it's done all of this, it's finding what policy is out there, it's finding what evidence is out there, and it's putting it into bite-sized chunks for you. So think about signing up to newsletters and getting on newsletters that matter to you, so that you're not just getting an inbox box full of newsletters, but yeah, be selective, decide what's relevant to you. Next slide, please. Maximise the benefits of being a member of a profession with tens of thousands of people, and that's just the children's nursing part of it. So speak the same language, use the buzzwords that are out there. So change is one that's there, fit for the future, fixing things, they're the buzzwords at the moment. So find out what the language is, speak the same language. If you're working with partners from other agencies, understand what their language is, because it's very different. It's very different to our nursing language, but it's easy to become multilingual when we're focusing on the same group of children and young people. And focus on the similarities, don't assume exclusion. So in terms of, and I'll use the assisted dying example here, that we focus on the similarities. It doesn't say anything about children really within that assisted dying bill, but we can say, just because you've excluded us in terms of the words, it doesn't mean you're actually excluding us from the policy. So what are the issues in terms of similarities there? So look what's there and make it real for you. Network, strengthen numbers, so working in partnership and networks, and then networking across networks. So if you've got something in the East Midlands, talk to the West Midlands, talk to the North East. We're a relatively small country. We've got the opportunities to do that. Please don't rely on one person, because if you rely on one person and that person leaves, then that work is going to be lost. So don't just rely on one person. Think about the future. Think about it, succession planning. Find the shortcuts. So subscribing to updates, I've already talked about that. Finding your keyword searches. So, you know, help yourself. Nobody's got too much time. So make the best use of time by thinking about how you can use the shortcuts wisely. And then think outside the health box, because children and young people and their families don't live in that health box. They live in the real world, and there's lots of boxes that they enter and leave. So think about how we can maximise policy benefits by thinking more broadly. So broadly, focus on what's the same, don't assume that exclusion, and that helps us really make the most of what policy is out there. Go on to the next slide, please. This is talking about turning policy into practice. So just very quickly, how do we do that? For me, I've focused on getting the policy right, because at the moment we're in a bit of a sort of policy desert. We had the last government's policy, we haven't got the new government's yet. So how do we, when we get it, turn policy into practice? Next slide, please. So if we identify our vision for the service development, so you've got the policy saying this is what we want to do. What's our vision locally? How do we do that? And what does it mean for us sort of locally? So what are the issues? How do we carry out that analysis of needs? So we need real-time data, we need information, we need trends, we need quality, we need feedback. We may not be the best at analysing any of that. So who can our partners be? We've got universities out there doing a lot of work. So how can we build the networks that takes us just from practice into those academics who can help us? We also need to think about our clinical leadership, sort of what's the workforce for children and young people services, sort of how do we access specialist services, what's the nursing remit here, what are the other issues, who are the others who are involved here. So think about all of those things as you're starting to build on that vision to turn it into a practical policy. Think about where the care is going to be. Is that going to be community? Is it going to be hospital? Is it going to be both? Wherever it's going to be, we need to be able to build those networks and to work with others so that whatever policy or service development we see is going to work across boundaries. It's not just something that works wonderfully for us in our hospital, and then when the child is discharged home on a Friday afternoon, it all falls to pieces. The child goes home on the Friday afternoon and is back by Saturday because we haven't got the things right in the community. So thinking about those areas where we need to be networking and we need to be working together, and the service development that we see is going to link into service activity in different areas. Next slide, please. Some of the challenges, these aren't new. You could tell me a whole load more, I'm guessing. If we go on to the next slide, please. Workforce, we've got a new government that's sort of going to be churning out lots of work for us to do. Austerity, finances, we'll know a little bit more later this week. Nothing seems to be mandatory. It's a great idea, but we're not actually doing it. There's a lot of localization. Everyone's short of time. Maybe a lack of motivation in some areas. We've tried this before, all of those different issues around change and the management of change. Competition, what's the funding going to do? Is it going to bring more competition? Or is it going to bring less? Are things changing? And then what about public opinion? We know that we've got to build that trust in health service and health professionals. So quite a lot of challenges out there when we're looking at policy development. Move on to the next slide, please. So we've got a whole range of services that are involved with children. We've got a range of policies that are going to be coming in around children's care and children and families' lives. Build on the similarities that we've got with adult care and children's care, and acknowledge that we've got differences. But most of all, I'd say use your power, because you're incredibly powerful people. You can go on to the next slide. It really is that question to you all. What are